Today, we're talking about something that affects millions of couples but rarely gets discussed openly: male fertility. Stop scrolling and pay attention because what I'm about to share might completely change how you approach your fertility journey. Hi, I'm Dr. Omama Simmons. I've been a naturopathic fertility specialist for close to 20 years, and today we're talking all about male fertility, so let's get into it. Did you know that sperm counts have dropped by over 50% in the last 40 years? No, that's not a typo. Half of what was considered normal just a generation ago is now low. Here's what's even more shocking. Spending at least 50% of your work time in a sedentary position doubles the risk of sperm DNA damage, likely due to heat stress on the testicles. This isn't just about having babies, it's about understanding a global health crisis that's happening right now. Whether you're actively trying to conceive, thinking about it for the future, or just concerned about your overall health, this information is critical. Today, I'm breaking down what's exactly behind the alarming decline and, more importantly, what you can do about it. Because fertility takes two. It's time we start talking about both sides of the equation. Before we dive in, let me share something important. I've been working with couples struggling with fertility for years, and I've seen firsthand how focusing solely on female factors can lead to frustration, wasted time, and unnecessary treatments. The reality is, male factors contribute to about 50% of all fertility challenges. Yet, when couples struggle to conceive, the focus immediately shifts onto the women's reproductive health, while men get a basic semen analysis at most, and sometimes not even that. If they have had a basic semen analysis, they're usually told, your sperm are great. So that's a problem. Let's look at what's happening globally. A landmark study published in the Journal of Human Reproduction analyzed data from 40,000 men across North America, Europe, Australia, and New Zealand. The results were staggering: a 52.4% decline in sperm concentration between 1973 and 2011. That was 14 years ago. So the decline isn't slowing down. More recent data suggests that that trend is continuing and possibly accelerating. But why? What's causing the dramatic shift in just a few decades? That's what we're talking about today: the environmental, lifestyle, and health factors behind the sperm decline and the practical steps you can take to protect and improve your fertility. Let's break down the major factors contributing to this global decline of male fertility, lovingly called Spermageddon. First, sedentary lifestyle crisis. Remember that shocking fact I mentioned at the beginning? Spending half of your workday sitting doubles the risk of sperm DNA damage. This isn't just about being inactive, it's specifically about heat exposure to the testicles. Your reproductive system is designed to keep sperm at a temperature about 2 degrees cooler than your core body temperature. That's why the testicles hang outside the body. When you sit for prolonged periods, especially with the laptop on your lap or in really tight clothing, you're essentially cooking your balls and the sperm inside them. A study from the Danish Sperm Quality showed that men with primarily sedentary jobs had significantly lower sperm counts and poorer sperm motility compared to men with more active occupations. And this effect was independent of other lifestyle factor. Number two, environmental toxins. We're exposed to more chemicals now than at any point in human history. Many of these chemicals are endocrine disruptors, substances that interfere with your hormonal system. Plastics containing BPA, phthalates, pesticides, flame retardants, and even components in nonstick cookware can all mimic estrogen in the body and block testosterone production. These chemicals are everywhere in our food packaging, personal care products, furniture, and water supply. A 2021 study found that men with higher levels of phthalates in their urine had significantly lower sperm counts and more abnormally shaped sperm, aka poor sperm morphology. And These aren't just one time exposures, these chemicals can bioaccumulate in your body over time. The biggest exposure of phthalates is actually from fragrances. So if you look at any of your healthcare products or have fragrances in your home, in your car, you are being exposed to a high level of phthalates, which can be affecting your sperm morphology. Number 3, nutrient deficiencies. Our modern diet is energy rich but nutrient poor. Specific nutrients like zinc, selenium, folate, and antioxidants are especially important for sperm production and protection. Unfortunately, soil depletion means even fruits and vegetables contain fewer nutrients than they did a few decades ago. Combine that with highly processed diets, and many men are functionally deficient in key fertility nutrients. For example, zinc deficiency is associated with low testosterone levels and decreased sperm production. A study in fertility sterility found that men with fertility issues had significantly lower zinc levels compared to fertile men. Number 4, stress and sleep disruption. Chronic stress and poor sleep are perhaps the most underappreciated factors in fertility across the board, especially in men. When you're stressed, your body produces cortisol, which suppresses reproductive hormone production. A study from Stanford University found that men who reported high stress levels had significantly lower sperm concentrations and more abnormal sperm morphology compared to men with lower stress levels. What a surprise! Sleep disruption compounds this problem. During deep sleep, your body produces most of its testosterone. Disrupted sleep patterns from shift work, blue light exposure, or sleep disorders can significantly reduce testosterone production. A 2021 study found that men who slept less than 6 hours per night had testosterone levels compared to men 10 years older than them. Think about that. Poor sleep can age your reproductive system by an entire decade. All right, now some hidden factors that most doctors are not discussing. Let's talk about some of the obvious factors that you may not be thinking about nor talking about with your doctor. Number 1 is electromagnetic radiation. We're constantly surrounded by electromagnetic fields, EMFs, from our phones, Wi Fi routers, and other electronic devices. While the research is still evolving, several studies have found associations between EMF exposure and reduced sperm quality. A meta analysis published in Environmental Research found that men who kept their phones in their front pocket had significantly lower sperm motility and viability. The effect was dose dependent. The longer the exposure, the greater the impact. This doesn't mean you need to throw away your phone, but being mindful of where you carry it and using airplane mode whenever possible can make a huge difference. Number 2 is prescription medications. Many common medications can impact male fertility without warning. Antidepressants, blood pressure medications, antibiotics, and even some over the counter pain relievers can affect sperm production or function. For example, certain antidepressants like SSRIs can cause delayed ejaculation and reduce sperm concentration. Some blood pressure medications can lead to erectile dysfunction or decreased libido. If you are trying to conceive and taking any medications, it's really important to discuss potential fertility impacts with your healthcare provider. There may be alternative medications with fewer reproductive side effects, or you can certainly talk to a holistic and functional practitioner to substitute with more natural means that don't affect your testosterone or sperm at all. Number 3 is going to be microbiome disruption. This is the cutting edge research that most fertility specialists aren't even talking about yet. Your gut microbiome, the trillions of bacteria that live in your digestive system, play a crucial role in hormone metabolism and immune function. Recent studies have found that men with fertility issues often have distinctive gut microbiome patterns compared to fertile men. These differences can affect how your body processes hormones and manages inflammation. Additionally, there's emerging evidence that a reproductive microbiome, specific bacterial communities in the male reproductive tract that may directly impact sperm health. Disruptions to these microbial communities from antibiotics, poor diet, and infections may contribute to further fertility problems. A 2020 study in the journal Andrology found that men with abnormal semen parameters had significantly different seminal microbiome compositions compared to men with normal parameters. Now, for the part that you all have been waiting for, what can you actually do about this? Here are evidence-based strategies to protect and improve your fertility. First and foremost, movement and heat management. The solution to the sedentary lifestyle problem is simple but requires consistency. Take movement breaks every 30 minutes or so when you're sitting. Consider a standing desk for at least part of your workday. Avoid hot tubs, saunas, and very hot baths when you're trying to conceive. Wear loose-fitting underwear and pants. Keep laptops on desks, not on your lap. And if you exercise intensely, allow adequate recovery time. Excessive heat during intense exercise can temporarily reduce sperm production. Next, let's do an environmental detox. While you can't avoid all of the environmental toxins, you can significantly reduce your exposure. Switch to glass or stainless steel food storage containers instead of plastic. Filter your drinking water and drink from glass or stainless steel only. Choose organic produce for the dirty dozen most contaminated fruits and vegetables. Use natural cleaning products around the house. Read labels on personal care products and avoid parabens, phthalates, and fragrances. Remove shoes at the door to avoid tracking pesticides into your home, and choose natural fiber clothing and bedding when possible. Number 3, fertility supporting nutrition. Focus on these key nutrients and food sources. Zinc from oysters, pumpkin seeds, grass-fed beef. Selenium from Brazil nuts, just 2 to 3 daily, as well as wild-caught fish. Antioxidants come from colorful fruits and vegetables, especially berries. Omega-3 fatty acids from wild-caught fatty fish, walnuts, flax seeds, etc. Folate from green leafy vegetables, lentils, and avocados. Vitamin D from loads of sunshine, fatty fish, and egg yolks. And last but not least, CoQ10 from organ meats, fatty fish, or supplementation. Remember, supplementation should be targeted based on your specific needs. Random supplements without proper knowledge can sometimes do more harm than good. Consider testing for deficiencies before starting any supplement regimen. Strategy number 4, stress management and sleep optimization. These strategies can help you manage stress and improve sleep quality. Establish a consistent sleep schedule, even on the weekends. This strategy has been shown to improve reproductive hormones by 30%. Aim for 7 to 9 hours of quality sleep. Create a sleep sanctuary that's cool, dark, and free from electronics. Practice stress reduction techniques like meditation, deep breathing, or yoga. Consider adaptogenic herbs like ashwagandha, which have been shown to improve sperm parameters in stressed men. Limit caffeine after noon and alcohol in the evening. Expose yourself to natural sunlight, especially in the morning, to regulate your circadian rhythms, and try mind-body practices like progressive muscle relaxation or 5 minutes of mindful body scanning before bed. A 2018 study found that men who practiced meditation and yoga for just 12 weeks had significant improvement in sperm count, motility, and morphology compared to the control group. The global decline in male fertility is a complex issue with multiple causes, but that also means there are multiple opportunities for intervention. The good news is that sperm regenerate approximately every 74 days. So positive changes that you make now can impact your fertility relatively quickly. If you're trying to conceive or planning for the future, I recommend taking these steps. Get a comprehensive fertility assessment, not just basic semen analysis. Look for a specialist who will evaluate DNA fragmentation, not just count and motility. Number 2, implement the lifestyle changes that we talked about in this video consistently for at least 3 to 4 months to see meaningful improvements. Number 3, consider working with a functional medicine practitioner or fertility specialist who understands the importance of addressing the root cause, not just symptoms, especially in men, not just women. And last but not least, remember that fertility is a couple's journey. Both partners should be optimizing their health for the best chances of conception. I hope this video has given you valuable insight and practical strategies to protect and improve your fertility and the sperm. If you found this video helpful, please give it a thumbs up, subscribe for more evidence-based fertility content. Drop a comment below with questions or topics that you would like me to cover in future videos. And if you're looking for more personalized support, definitely check out our link in the description for information about my fertility programs and resources. Remember, knowledge is power, and understanding what's happening with your body is the first step toward positive change. Thanks for watching. I'll see you in the next video.